Hello and welcome. Today, Mark will be reviewing his holding in Alliance Pharma plc, which is a leading international healthcare business. The company was established in the UK over 20 years ago, and today it markets products in over 100 countries worldwide. Now, Mark will naturally be talking about how Alliance has performed with respect to creating value for shareholders, but he'll also be discussing how the company was recently accused of anti-competitive practices by the Competition and Markets Authority, an accusation that was subsequently disproved. So, to hear Mark's opinions about Alliance and to find out more about that intriguing legal case, stay tuned to this, episode 26 of The Desert Island Investor. This episode of the podcast is generously hosted by Progressive Equity Research. Visit their website at progressive-research.com. Good afternoon, Mark.
Hello again, my friend.
This week we are discussing Alliance Pharma plc, ticker symbol APH. And this is quite an interesting stock, quite a lot of complex things going on. But to start off with, can we just dive straight in with the base numbers?
Yes, it's a market cap of 241.4 million, a PE of 9.8, and a yield of 0. There's no current dividend, and that's based on a share price of 44.85 pence.
And when did it first list?
It's AIM listed and was brought to the market in 2003.
And what's the history of your holding?
Well, I first bought back in July 2014 at 33.775 pence, and then again in October 2017 at 58.75 pence. The average for what it's worth is 42.4 pence, but of course there's a 3-year gap between those two trades.
Okay. With each episode, we seem to discuss some different angle about your holding. And this particular one, with Alliance Pharma, you think the name's a bit misleading?
Yeah, when we talk about pharma or pharmaceutical businesses, we think about R&D with people in the laboratory. And the average period of time, apparently, for a product to pass from discovery to full approval is 10 years. With the trial stages lasting 6 to 7. Now, according to an article from the Congressional Budget Office in April 2021, the FDA only approves 12%. Then on top of that, after that research and capex, if you have a winner, you've only got 20 years until that patent expires, and then you're competing against generics that have got your recipe. And in addition, even if it's been approved, if it's found that there are harmful side effects, some of which can take a long time to become apparent, then there can be litigation from claimants for some mind-boggling amounts. And timely, Paul, is news that came out from Glaxo just this month that they've come to a settlement in the US where they've faced 80,000 claimants for the Zantac product, which is first came to the market. So talk about this being a slow burn in 1983, and this is a product for heartburn. But the accusation is that it can cause cancer when exposed to heat. So Glaxo have said that they're not going to admit any wrongdoing in any of the cases, but at the end of the day, they've made a settlement of $2.2 billion, which is 1.68 billion sterling. So,
wow,
yeah, it's not penny. Yeah, it's not penny numbers. Now, Glaxo have got a market capitalization of 59 billion, but 1.68 billion is still a big number. So, that's what I think about I think pharmaceuticals is a difficult area, and I think to myself, is there not an easier way to make a product? And I'm coming back to Alliance Pharma. They're predominantly a supplier of consumer healthcare products. They don't do any expensive R&D. Their model is to buy these brands off others that have done the heavy lifting, and these are typically from much larger businesses where these products are probably small and niche, but attractive to a company the size of Alliance.
So are these products over the counter or are they just for prescription?
Well, if we're using the interim results, which were released on the 30th of September 2024, 61.4 million was consumer healthcare and 23.3 million prescription medicine. So that's a 72.5%, 27.5% split in favour of consumer healthcare. Now, consumer healthcare does not have that barrier of arranging a prescription. You walk into a pharmacy and you pick it up off the shelf or increasingly buy it online.
Shall we then run through some of their brands? Perhaps some of our listeners will be familiar with them.
Yes, they've around 80 consumer healthcare brands and prescription medicines, and they're sold in over 100 countries. But they have a number of what they call their star brands. Now, they give the top three, they give their respective revenues, and by far and away the biggest is Kelo-Cote, which is that's had revenue of 29.2 million. And this is for the treatment of scars through surgery, trauma, wounds or burns, and it flattens raised scars and reduces the redness and the discoloration. And I have to say that this is a product that I've used personally. I'd like to say it was from a dueling scar or through cage fighting, or I was mauled by a bear when fur trapping in Canada, but it was actually because I came into contact with a corrosive substance. Now, I was aware of the product through Alliance, and the product reviews were really good, and it sounded too good to be true. Was this not like some kind of snake oil? But after applying it for a couple of weeks, I was really pleased with the results, and some while after I recommended it to a family member, and they too had some very good and satisfying results. So some further flesh on this product. It's the leading silicone scar treatment with 11% market share globally. And from when it was purchased from Sinclair in 2015, they've grown the sales from just 8 million to 63.2 million in 2023. So that's a compound annual growth rate from 2018 to 2023 of 23%. Now, they also do another product called Nizoral, and that has sales of 8.3 million, and they have the rights to this product in Asia Pacific. Now, I did do a little bit of market research on this. I wandered into my local Tesco, and Nizoral is sold in the UK. So I'm just trying to come on. This is a premium product, Paul, for dandruff. It's a dandruff shampoo. And in the UK, it's marketed by Thornton and Ross, who are a German company. But just giving a bit of an idea of what a premium product is. There were, I think, 5 shampoo brands, and Nizoral was the top one. It was £7 for a bottle, which is £11.67 per 100 millilitres. And it was 3.9 times more expensive than the next one, which was Neutrogena T-Gel 2-in-1. So that was the next premium brand. Then behind that, Head & Shoulders. So that's the market leader. It was 8.6 times more expensive than that. Vosine, which is claimed to be dermatologically tested. Well, I hope so. It was 17.3 times more expensive than that. And Tesco actually do their own home brand, which is looks very much like a Head & Shoulders wannabe lookalike. And that was, it's 31.7 times more expensive than that. So you can see that this is very much a premium product. Now, Alliance claim that 3% of the population experience or suffer from acute dandruff, and they market Nizoral as a product that helps people be accepted socially and advanced professionally. So just on this, Paul, can you just give us what the marketing angle is? You're the marketing man. I don't think I would shun anybody from my social circle because they've had dandruff, and equally, I don't think it would prevent me from employing somebody. So, I've not been put off by this nasty rash that you keep scratching. Now, I speak as a bald-headed man, and I've seen the adverts. I think it was regain your hair, regain your confidence. Well, it hasn't affected my life other than having to put a hat on in the sunshine on the island here. So, what are these marketing people trying to do, Paul, with our heads? They're trying to sell by fear. And have you ever been gone into these dark arts?
Oh, yeah, that's the job. Basically, just pressing your buttons, Mark. And anyway, if you'd have bought that Regain, you might have hair now.
Yeah, okay.
It might actually work, but
yeah.
I'm sure they will. If you look at the small print on the bottle, it won't actually claim that it works in the small print. It's just it claims that in the advertising.
Yeah. But you see a lot of this. They're trying to push people into buying something, creating a need, aren't they? Through fear, I think a lot of the time.
Yeah, absolutely. It's yes, people are very self-conscious about things, and that's something that it's quite easy to get a handle on that. If you're trying to sell something that improves the way that you look or improves your confidence, like you say, if you're not worried about it, then you're not going to be one of their customers. But I'm sure they're selling quite a lot of it.
Yeah, and these are products. In these emerging countries, if your belly's rumbling, you're not bothered about your dandruff, are you? But as you get more disposable income, then these are products that people are increasingly going to buy. So I'll carry on. So Amber M, back onto the brands that they have. This is a 5.2 million. This is a menopause supplement, which again I've not tried. They've got 20% of the bricks and mortar market in the US and just 7% on Amazon, which is the majority of online in the States. And this is interesting that there is such a stark difference between the two. So the market is pivoting to online, and it's something Alliance are addressing. And the internet's been around for a long time, but in these podcasts, we continue to witness this change across many businesses still. They do a product called MacuShield, which is an eye supplement for macular degeneration. The Mousse, which is a mousse for head lice. That's to kill them and not to feed them. Hydromol for eczema. Forceval, which is a multivitamin. Ashton and Parsons, which is teething gel and powder. Ambisol for mouth ulcers and denture irritation, and Aloe Claire again for mouth ulcers. So, Paul, are you prepared to admit that you're familiar with any of these products?
I'm not. No, I can't. I have to confess I haven't heard of any of those.
Right. Okay. They do own Lipsil, which is the lip balm, and
Lipsil. Yeah, I've heard of that.
Yeah. Well, we could perhaps do with some of that. It would be quite handy on the island with our chap lips with the sun and the wind and the salt water. So, a number of these products are a distress purchase. If you've got a crying baby through teething or a child that's off school with head lice, or a flare up of eczema or that unsightly scar, lots of people will pay a few quid for a remedy. Now, I looked up the Vermousse, which is the head lice shampoo, and it was $13.99 online plus £2.95 postage. Or, of course, you can just nip into your pharmacy.
Very useful if you have a teething baby with head lice, eczema, and dandruff.
Yeah. It's going to be lack of sleep there, I think.
Okay, so where are they acquiring these brands from?
Well, they've been sold by some relatively small businesses, and Alliance have also got their hands on these brands by acquiring the whole business that owns them. But I thought I'd just focus on some of the big beasts that have sold to Alliance. So in 2011, they bought the UK and Irish rights for Ambisol and Ashton and Parsons from Reckitt and Benckiser for $2.55 million. And today Reckitt is valued at $33 billion. In 2012, they bought some anti-malarial brands from AstraZeneca for $5.2 million, and AstraZeneca is valued at $182 billion. In 2013, they paid Novartis $11.5 million for, I think, if I get this right, cyanometrine, which is an obstetric drug used during labour, and they paid $3 million for the UK and Republic of Ireland rights for Lipsil. Novartis is valued at $249 billion. In 2014, they bought a thyroid product from Bayer. This had sales of just 0.8 million euros and a gross margin of 0.5 million euros, and Bayer is valued at 29 billion. In 2017, they bought Aim Top, which is an anesthetic gel for $7.5 million from Smith & Nephew, who were valued at 10 billion. And in 2018, they bought the marketing rights for Nizoral in Asia Pacific for 60 million from Johnson & Johnson, who were valued at $360 billion. So I think you can see how insignificant these products are in relation to the size of the sellers. Now, these are insignificant trifles. If you and I had a thyroid product with sales of 0.8 million euros and a gross margin of 0.5 million euros, I think we'd be over the moon. But there's these are just niche products, and I'm sure that there's some accountants somewhere that's saying this, it's just not worth my time pressing the calculator and putting a line in the accounts. And Alliance are foraging off the crumbs from the Lord's table.
So from this, it's clear that Alliance is very much an acquisition-led business.
Yes, John Dawson started the business when they acquired some niche products from Novartis in 1998 under what they called a fostering arrangement. And you could say what they do, it could be described as quite parasitical in a way, but they do, I think, serve as a company, serve a useful purpose, hoovering up these brands. And they do produce some, or they don't do the research and development, they do market some variants of the different brands. For example, they can produce a gummy formulation. So they have a long track record of buying and absorbing businesses and products. And as a result, there is a lot of goodwill on the books. You can't internally create goodwill. It's a product of acquisitions.
Presumably, this buying spree brings with it some debt, though.
Yes, they've taken on debt with these purchases, but historically, they've been very cash generative. It's a very cash generative model. And they don't have that costly R&D, as we said, and they outsource their manufacturing, their storage, and their logistics. So at the last full year, they had revenue of 180.7 million. And they do this with just 284 employees. Now, they've taken on debt, but they traditionally pay this down rapidly. And at the interims, the debt was 83.2 million, and that was down from 91.2 million at the year end.
Now, one issue I know that you wanted to raise for this episode of the podcast was a legal matter that Alliance Pharma became embroiled in.
Yeah, I think it's an interesting story. So in May 2019, the Competition and Markets Authority, the CMA, they alleged that Alliance had entered into anti-competitive agreements regarding the sale of chlorpyrazine. That's difficult for me to say. And it's used to combat sickness in pregnancy and motion sickness. Now, until 2013, it was marketed exclusively by Alliance, but then it was licensed out for a fixed fee to Focus Pharmaceuticals. Now, it was a niche product, even for Alliance, and it had peak sales of 1.9 million in 2015 and just £200,000 in 2018. Now, the case involved a time span from 2013 to 2018. Now, John Dawson had been the CEO, and Peter Butterfield became the new CEO in 2018. He'd previously been deputy, and when he took over, John Dawson remained as a non-exec. Now, Peter had been with the company since 2010 after the takeover of Cambridge Laboratories. Now, I'll read this from the CMA, and it's on the government website from May 2019. It says, the CMA provisionally finds that Alliance Pharmaceuticals, Focus, Lexon, and Medreich entered into an overarching agreement that was implemented through two separate agreements. One between Alliance Pharmaceuticals and Focus, and one between Focus, Lexon, and Medreich. Under these alleged agreements, Alliance Pharmaceuticals supplied prochlorpyrazine exclusively to Focus. Focus then paid Lexon a share of the profits it earned on the onward sales of Alliance's Pharmaceuticals prochlorpyrazine. Lexon, in turn, shared these payments with Medreich. In its provisional findings, the CMA alleges that before entering into this agreement, Lexon and Medreich have been taking steps to launch their jointly developed prochlorpyrazine. Although Medreich obtained a license to supply prochlorpyrazine in January 2014, it did not supply the product until November 2017. The CMA alleges that each of the agreements between Alliance Pharmaceuticals and Focus, and between Focus, Lexon, and Medreich individually broke competition law. So, this was concerning, but I was sure, I was confident that we were on sure ground. There was surely no motivation for Alliance to become involved in any price rigging. They'd license out their product, and out to focus. So surely there was no upside. So we slow forward. This is how the law works, these courts work. To February 2022, and the CMA fined Focus 15.5 million, Lexon 7.3 million, Medreich 4.6 million, and this was reduced by 40% for admitting involvement. And lo and behold, Paul, Alliance 7.9 million. So I really couldn't make any sense of this, and it felt like classic guilt by association. Where they doling out these fines and just, well, whilst we're at it, you can have a bit too. So all these fines help swell the coffers. And I was reminded of that saying, when the bawdy house is raided by the police, even the piano player is arrested. So Alliance appealed against this. In September 2022, the CMA issued a CDO, which is a competition disqualification order against Peter Butterfield and John Dawson, whereby they'd be barred from standing as directors. So you can imagine the personal pressure that this must have brought, and a major distraction for the business. And Alliance continued to stress their innocence. Now, in November 2022, it was announced that Peter Butterfield was taking some time away from the business for personal reasons, and little wonder. And he made a phased return in the first quarter of 2023. So again, not ideal when the top man is away from the business. And on the 8th of May 2024, Peter Butterfield announced that he was leaving the company to pursue other business interests. So then, on the 23rd of May of this year, 2024, Alliance announced that they'd successfully won their appeal with the Competition Appeal Tribunal. Now, the hearing took 11 days, and I'll read a short extract from the 117-page non-confidential judgment. I think the original was some 727 pages. It says, "We found both of the Alliance witnesses to be credible and reliable. Mr. Butterfield and Mr. Dawson were both impressive and compelling witnesses who gave their evidence in a clear and courteous manner and did not change their position in the face of rigorous cross-examination. They were both careful to distinguish their personal recollections from matters which they had learned subsequently or had worked out from looking at documents. Both of them showed a strong sense of solid business integrity. Mr. Dawson was cross-examined on certain prior inconsistent statements he had made during his CMA interview. We did not find these statements impacted adversely on his credibility. His interview was at an early stage at which Mr. Dawson was not fully informed, and he took immediate steps to correct errors by solicitor's letter to the CMA. We prefer his evidence given on oath to us at the hearing to what he said at interview." So after 5 years, Paul, 5 long years, exonerated without a stain on their character, Paul. So no fine to pay, but I do not think there was any compensation for the upheaval this has caused the company on a personal level to Messrs. Butterfield and Dawson. So listening to that, any thoughts?
Well, it sounds like it must have been a very complicated case. I think your comment about guilty by association is correct, really. I mean, I don't know anything about this, but as a casual observer, it is telling that Medreich pleaded guilty to a collusion of some sort, and they volunteered to cooperate with the inquiry to get a reduced fine, I gather. So, I mean, innocent people don't generally take plea bargains. So I think the fact that the CMA messed up the case and didn't provide adequate evidence of there being anything formal in place doesn't automatically make Medreich's confession irrelevant. I think they just dodged a bullet by the sounds of it. But Alliance's involvement does seem rather strange, to lump them in.
Yeah.
But of course, if Medreich confessed of some collusion, then at least one other party in that trio must have been guilty as well. So,
well, it's a strange what the CMA can't make it stick, isn't it? Or, I mean, I've just read an article from Pharmacy Magazine where they go on about this, and it's from an article. The author's a guy called Arthur Walsh, and he puts Medreich did not take part in the appeal. Medreich, which did not take part in the appeal, reportedly admitted to the CMA in 2022 that had taken part in a breach of competition rules around chlorperazine in return for a reduced fine. However, the tribunal judgment finds because there was no MEA, there was nothing for Focus and Medrack to participate in, and no such breach. Medrack, so Medrack, it says Medrack have been approached for comment. So they've apparently pleaded guilty to something that didn't happen according to the tribunal.
Well, so, they pleaded guilty to something that the CMA couldn't prove happened.
Yeah.
But I mean, that often happens, doesn't it? Cases just fall apart because there's insufficient evidence. I mean, just because they didn't find a document, they didn't find a dodgy document with signatures on, did they? So
yeah, I mean, have they said, "Well, let's pay it and let's move on," rather than have it hanging over us? And is it sometimes a bit like these? You sometimes see these cases in America where people are going. It's either the death penalty or life. Life imprisonment. Do you want to admit to it? So I don't know, but it's certainly an odd one. And I mean, you said to me about this when we covered Alliance. Or did the other ones get off? And I thought in my head, my memory, they did. But it's one of those as an investor. It's academic what happens to the others because I'm just interested in Alliance, and I try and put my energies, my time into my energies into my investments, and it's immaterial what was elsewhere. But just on the price that went up, a 50-pack of this drug, which I'm struggling to pronounce, went up from £6.49 to £51.68. So it certainly went up a long way. So that was to the NHS. So perhaps they should be shopping around a bit more, because I believe there are, and my daughter's a pharmacist, and I think there are alternatives to this product. So it's are they just rubber stamping the next invoice that comes through? I don't know.
Absolutely. Well, they should be the ones on trial. The NHS. I mean, it's just a ridiculous. You can't take a product that goes from £5 to £51 and carry on buying it. I mean, why on earth? I mean, well, because it's not their money, is it? I suppose it's taxpayers' money, so they can spend it as they wish. But something else must have been involved with that kind of hike. I mean, you can't put that down to change in the cost of logistics or transportation or raw materials. Have you worked out what percentage of increase that is?
No, I haven't, to be honest. It comes with the category of a lot, Paul. That's £6.49 to £51.60.
Oh, I'm sorry. Sorry.
Yeah. Let's not. It didn't start at that price. Let's give them some credit. So we're not experts in this. If there's people out there who know this case, let us know the finer dealings of it. Which I'm just really interested in the Alliance side, and the other side of it's academic. But if people, I just thought it was rather an interesting case. It's something that dragged on and then fell in on itself.
So, well, they all live to fight another day, so to speak. Yeah. And the main thing is, I think, yes, Alliance quite correctly have been vindicated from that. So, which is good for you, because they sell products that you're probably going to need as you get older.
Yeah, thanks, and for the people involved, it must have been, very distressing for them, on a human level.
Right. So, we've covered what the outcome was, haven't we? Basically, or have we? What was the final outcome of it as far as
not guilty, not guilty,
not guilty,
no fine.
No fine at all.
Yeah.
So, again, I don't want to dwell on the other. Did the other companies pay their fines? Have they got
I don't think so.
All
so
right.
I don't know Amsterdam Medrack now, whether they get their money back. So they've admitted guilt, they've paid the fine, and they say, well, can we have our money? Because I think it's something we spoke about before. I think once you pay a fine, it's an admission of guilt, isn't it?
Okay, another issue that you wanted to raise was the delayed release of the full year results earlier this year. And I understand that this was due to the auditors requesting more time.
Yeah, on the 4th of March 2024, Alliance advised that the preliminary results would be released on the 9th of April. And on the 5th of April, there was an update advising that results would be released on the 23rd of April due to the volume of work that the auditors had in completing the audit. Now, on the 22nd of April, there was a further update. The release was put back until early May. And the audit was at an advanced stage. And on the 26th of April, it was advised that results will be published on the 8th of May. And on the 8th of May, it was advised that the audit process was ongoing and there will be an update on a revised timing in due course. So finally, the results were released on the 19th of June. So any delay in results being released generally does not bode well, especially when the auditor's involved. And what have they found? Skeletons in the cupboard or a mass grave. Then you have this successive backsliding on the date, and it doesn't do a lot to manage expectations.
So what was the outcome when were the results finally revealed?
So, well, the big takeaway, there was a very large impairment against a number of assets, and that the auditor, Deloitte, had found weaknesses in their internal controls. Now, firstly, they restated the 2022 accounts and impaired 28.3 million. That was 20 million for Amber N and 8.3 million against other brands. And then in 2023, a further 46.3 million lopped off Amber N, Nizarel 10.3 million, and 22.6 million off others, including Vermoose 4.7 million and Optiflow 4.5 million. So it was announced on the 8th of August 2022 that Deloitte had been appointed after KPMG had resigned after corporate governance issues, and specifically it was the accounting treatment of that proposed 7.9 million fine from the CMA poll. So again, you can see that this running sore from this issue and its knock-on effect, and the irony that it was eventually overruled. So two wrongs don't make a right, but you can see how things may have been different without this CMA investigation and that initial ruling. And secondly, it looks as though Deloitte were more robust and forensic in their work than KPMG.
So those impairments are big numbers. How does that affect the business?
Well, that's a write-down of the goodwill that we mentioned earlier, and it's the intangible value of those assets over what was paid for them. And so there's no loss of cash. It's not as though they have to stump up 100 million plus, but it represents what they think the real value of these assets are against future cash flows. And it's an impairment against the money that they've already spent.
So that aside, how did they perform?
Well, despite an impairment, the organic side of the business continues pretty much as normal. Turnover was up 6% to 182.7 million. That's a record. Underlying profit before tax was up 4% at 31.5 million, and debt was down 91.2 million from 102 million. So it's still generating cash nicely.
And has that followed through in the recent interim results?
Well, Nick Sedgwick, the new CEO, he fronted up these results, and revenue was up 3.3% at 84.8 million. Underlying profit before tax up 23% to 12.7 million. And I said earlier, debt down from 91.2 million to 83.2 million. So these are, of course, just some basic figures, and there's much more to take into account and base your opinions upon, and you should read the report. In this podcast, naturally, we've only got limited time to try and focus on a couple of angles. Kilo Coat remains very much the star performer for them.
You mentioned earlier the number of countries they trade in. What is their geographic split?
From the interims, Europe, Middle East and Africa, I always think this is a bit of a disparate group, 46.7%. Asia, Pacific and China, 35.1%. And the Americas, 18.2%. So I think that's a nice mix. Africa is mixed in with Europe, but hopefully Alliance are increasingly tapping into these developing economies, and these growing consumer classes are increasingly interested in the kind of products that Alliance bring to market.
Right. All interesting stuff. As we start to wrap up, where does this sit in your portfolio?
Well, it's a little under 1%. It sits there within a group of others that I continue to monitor with the potential to take further.
So you opened your position in 2014, but you haven't added since 2017. So why is that?
Well, there've been times when I thought it's just been too pricey. It's not always been around 45 pence. It's been 80 pence, a pound, and it even hit £1.20 in early 2022. They had previously paid a progressive dividend that's been halted to concentrate on debt, which I approve of. And if I was trying to portray myself as some kind of investing genius, then perhaps we just cover stocks that had just reached their highs. What we're trying to show is the genuine experiences of a real life private investor. But we've had, of course, the overhang of the CMA, the directors potentially being struck off, the delay in the reporting, the impairment. And I suppose over the years, there's always been a more compelling investment case elsewhere in the portfolio. It's had to contend with these things over the last few years, but I'd not categorise it as a disaster. It's I've got my head above water on this one, and I think we've outlined it as an interesting business model, and it's got some defensive qualities.
Right. Okay, excellent. Thank you very much indeed for that, Mark. We've travelled from dandruff shampoo to courtroom drama. And I think we'll just wrap it up there then. Thanks again for your review of Alliance Pharma. Well, that's all for this episode. We hope that you enjoyed it. Please remember the content is for information only and it is not financial advice. If you have a question for Mark for our Question in a Bottle podcast, just complete the form on our website, thedesertislandinvestor.co.uk. Thanks again for listening. See you next time.